Well, hello everybody. I'm Dr. Glenn Harrison, and welcome to this week's segment where we answer answer the why to some of the most common health-related questions. So this is where I just take just a few minutes to answer some of the more common questions that either our viewers reach out to us, or my patients have, or just questions that I see every day. The question really is more of a concept today. It's all about heart disease. Heart disease is the leading killer in our world, and I don't know exact numbers that it is of our population, but it's significant. And heart disease doesn't just happen. I guess that's what I really want to get across. Regardless of family history, it doesn't just happen. So we have a lot of tests that we can look at it to predict the early warning signs and symptoms before it happens, and then be able to act accordingly in more of a preventative effort. So the first thing to remember is genetics only make 5 to 8% of outcome, even with heart disease. So you still have 95 to 98% is all about you, what you do, and how you live your life, and what you're exposed to. So that should be a good thing. 95 to 98% is all about you. The second thing is regarding tests, what you can do. So this video will be a little bit shorter because I'm just going to jump into tests. The tests that you can look at and talk to your provider to order, and we can always order those as well. A very important one is something called C-reactive protein, also known as high sensitivity C-reactive protein. Either of those two names, tests, those are great. Those are an indicator of heart inflammation. So if your doctor didn't order it, they should. It's way high up there in the one to order. And then of course all the cholesterols, looking at your LDL cholesterol, your HDL cholesterol, your total cholesterol, and also VLDL cholesterol. Those cholesterol markers are good. Most people, if they got a heart concern, cholesterol is already tested. Another marker is called homocysteine. Homocysteine is an inflammatory marker. You want to really make sure that's lower and it's not too high. And then the final one I'm going to mention is extremely important. Extremely important. It's the best indicator to predict future heart concerns or heart conditions. And it's called a calcium score test. So this is a test that's a CT exam. It's just a picture. And they'll take a picture of your heart. And what the CT exam is going to do is going to assess and analyze how much calcium is in your heart arteries or your coronary arteries. This is extremely important because calcium, signs of calcium in those arteries are the first indicator to developing plaque and ultimately having blockages in your heart arteries. If there's a blockage in one of these heart arteries, that leads to a heart attack. So measuring the calcium is the earliest sign, or is the earliest way to prevent any of this. It's absolutely remarkable. Most people over the age of 50 in my office that come in, and if they have any higher C-reactive protein or some cholesterol issues or a family history of heart disease, I'm very, very quick to order a calcium score test. Now, it's non-invasive. It's just a picture. Most imaging companies will order it, and you can always reach out to us if you're looking for a lab to get that done. But if there is higher amounts of calcium in these arteries, well, then you make certain changes. And I mentioned in a few previous videos, so you can go back into the other videos, I talk about cooking oils and all of that, and I think I even touch on blood sugar and how it affects our heart and drives up problems in our heart. But if we can address all of that stuff, and then take that picture again, take it once now, find out where you are, and then take that picture again, and another 6 months to a year, you will see the changes. So it's exciting. It's not like you're gonna have to go in for surgery or things like that, usually, if you catch it early. If you want more information about the calcium score test, there's an amazing documentary. It's titled The Widowmaker. A little bit of a dark title, but it's a great documentary, and it explains calcium scoring and what to look for. So calcium score isn't mainstream yet for whatever reason, probably because if there's higher calcium, there isn't a drug or a surgery to fix it. It's got to be a lifestyle component. But you will see the changes in the calcium and the risk of heart disease if you make the changes you need, and so you can have a before and after picture. So hopefully that was helpful regarding heart health and what you can do. And look back in some of my previous videos. I talk about fats and things like that they can have a significant impact on your heart for the better or for the worse. So look at those. And if you know of anybody struggling with heart disease, maybe they've dealt with something in the past, they had a few scares, or they're just higher risk, or maybe they're on cholesterol medication and that's as far as their treatment approach was, because usually it is. Forward them this video, send it to them so they can, they can explore this a little bit more, and they can always send a comment below and ask us some questions about that. So with that being said, I'm Dr. Glenn Harrison, and I look forward to talking to you next week, maybe in a week's time. Usually it's within a week, where we can answer why to another common health-related question. So have a great day, and we'll talk to you next time.